Your Excellency, the President and Commander-in-Chief, the Council of Governors, the Board and Directors of both SHA and DHA. Your Excellency, today I think I am a very happy person because of the many assignments you have given me and the many funds that were established by law through our colleagues in Parliament. We are operationalizing the last fund. The primary health care fund is up and running. The social health insurance fund is up and running. The PMSF fund is up and running. And today the ECCF is up and running. But Your Excellency, allow me to begin with a matter of geography. I come from Garissa, and in my county, and in those that neighbor Garissa, Wajir, Tana River, Marsabit, Isiolo, the word nearby does not mean what it means here in Nairobi. A family may be 3 or 4 hours from a hospital on a good day, but not on a rainy day where the roads are impassable. And I come to that because when this ministry speaks about ambulances, I am not reading from a policy paper. I am describing a very arithmetic of my own people and the millions of Kenyans who live where distance itself sometimes becomes a disease. Your Excellency, also allow me, because I spent many years, some with you, in the National Assembly, and even as a leader of majority, and passed many bills. But if those years taught me anything, it is this, that passing a law is the easy part. We passed the social health insurance, we passed the, I'm sure my colleagues passed all those 4 great laws. But if you look at Article 43 of our Constitution, Your Excellency, provides the right to health for all Kenyans, while Article 7 of the Health Act of 2017 provides the right to emergency treatment. Where am I going? I'm going where I'm saying that a statute can be gazetted in a single afternoon. A law can be assented to in one morning by the President. But turning into something an ordinary citizen can actually benefit from that sometimes takes many years. And it takes a head of state sometimes who refuses to lose interest once the cameras have moved. And it has taken nearly many years for us to reach where we are here today. Your Excellency, when we talk among ourselves and among our peers in the region on the health transformation and reforms that you have introduced in our country the last 4 years, from the Social Health Authority, which is today at 32.2 million registered members, from the claims that we have paid, and Your Excellency, our governors know it, that today the own source of revenue in our counties, the highest, between 67 to about 75%, depending on which county. A county like Mombasa must be getting more, and I really want to thank, because the governor of Mombasa has clocked 80% registration, and he still maintains the first position. From the next program, Your Excellency, today many Kenyans in the regions can access a CT scan, a mammograph, a complete theater, lab systems which are working, to the reform that you have introduced in the health commodity and technologies. Today, I can confirm and agree with the chair of the council that every item you ask KEMSA to deliver, every 10 items, they can deliver 9. And they are working very well with our county governments. Today, Your Excellency, healthcare workforce is very critical to the transformation that you have done. Today, you don't see any disputes. No more. You have sorted out You have helped us to sort out the internship issue. We have sorted out all the CBS with our doctors and nurses. You have allowed us to recruit 5,000 new nurses and midwives to make sure that we reduce as a country, our maternal and newborn mortality rates. And Your Excellency, we are about to finish with the Council of Governors, we are about to finish the study we undertook. And you'll be very happy, man, because we might be having below 200 in terms of maternal mortality rates. That the data we are using is the data of 2019. And many of the partners, Your Excellency, will agree with us. Your Excellency, finally, the Social Health Authority, the Digital Health Agency, and our county governments are ready. This center is live. The number is working. What remains is for you to hand it over today to the people of Kenya, Your Excellency. And Your Excellency, before I finish here, we have CEOs of our private health facilities, our level 6. We have CEOs of our faith-based health facilities. We have CEOs from our county government health facilities. We have our team from the diplomatic community, Your Excellency, because this is history today we're making. This is one of your signature within the healthcare ecosystem. And I am sure the naysayers, Your Excellency, if they say SHA is not working, then why have we paid 170 billion in the last 18 months? Nairobi County is the biggest recipient in the primary healthcare fund. Your Excellency, today you are finishing the journey, you are finishing the circle, and members of parliament here will agree with me. The many questions that used to come to parliament, Your Excellency, was that the Kenyan will be picked by an ambulance. He's taken to a hospital and the hospital will ask for a deposit. Maybe they don't have that deposit, that amount of money. Then they go to the next hospital. Then they go to the next hospital. In the end, that patient dies. Inside the ambulance, or even there's no ambulance to pick him. Today you are making history by making sure that emergency care, as provided for in the Constitution, is going to be actualized. So it's therefore my single honor, Your Excellency, and we really want to thank you because when we call you to showcase the reforms that you have delivered, you always create time. So we don't want to, your presence, we don't want to take it for granted. We really want to thank you, all of us who work within the healthcare system, both national and county.